Hi there, my name is Heather Stefanescu, and this is my project on how to reduce missed medical appointments and no-shows. Let's face it, our lives are busy, and missing an appointment for yourself or a member of your family is bound to happen. One way to begin solving the problem is to consider patients' perspectives. By understanding patients' perspectives, patient registration staff play an important role in providing superior customer service and help to set the tone for the healthcare organization to prevent missed appointments or no-shows. After patient registration staff check in a patient for their office visit, they will provide information on a 24-hour web-based patient portal. This web-based application uses a patient's email to send them a reminder about the day and time of their appointment and encourages them to log into their account for important information about their outpatient test or procedure. Once logged into the patient portal, patients can access direct links to videos about what to expect during their office visit or outpatient procedure, how long their procedure will take, detailed instructions on how to prepare, specific directions on where to park, and step-by-step directions on how to locate an office or outpatient testing facility and where to go when inside the building. Not only can you sign up for yourself, but you can request access for your children ages 13 and under. An account can also be set up for you by an adult, child, or caregiver, and anyone else that you designate to have access to your account, such as a spouse or a significant other. Sign up for a patient portal account today and let us make your lives a little easier. Opportunities for improvement in cost, access, and quality of care. Decrease the number of missed appointments or no-shows. Calling reminding patients about appointments is a time-consuming process for patient registration staff. Overall patient dissatisfaction and frustration occurs when patients do not understand what to expect during their office visit or outpatient procedure and where to locate an office or outpatient testing facility. This may interfere with quality of care and access to learning opportunities for the patient. Why do patients miss their appointments? Well, one of the problems that currently exists for patient registration staff is how to increase patient satisfaction and limit the number of missed appointments or no-shows. One way to begin solving the problem is to consider patients' perspectives. We need to see them as people and not just as another medical record number. And put ourselves in their shoes. What if we didn't know anything about the type of test or procedure that was scheduled for us by a healthcare provider? With that being said, some patients may be disoriented, confused, or even terrified about their medical procedure that they face. On the other hand, some patients may be worried about how their need for medical care may change or disrupt their lives. Patients may be worried about child care, trouble getting off work, and costs of the procedure. Benefits of the 24-hour web-based patient portal. You'll get an email reminder about the day and time of the appointment that encourages patients to log into their patient portal account. Direct links to videos about their office visit or outpatient procedure, how to prepare, and what to expect. Specific directions on how to locate an office or outpatient testing facility. Directions on where to park. Easy to follow step-by-step directions on where to go when inside the building. And also an email text box to communicate with clinical and administrative staff as well, with any further questions at the convenience of the patient and for healthcare staff as well. Google patent research related to missed appointments and no-shows. The first one I looked at was Joseph DeGratello's innovation, TextMD. It was a computer scheduling program that is downloaded onto a healthcare provider's office computer system. And using a patient's mobile phone, it sends an alert to a patient reminding them of the day and time of their appointment. Patients can confirm appointment by texting C to confirm their appointment. The other research I came across was Barbara McLaughlin's business method. Her method reminds patients about the day and time of their appointment, an illustration on how to get to their appointment, what to expect before they arrive for their office visit or outpatient procedure, and what to bring along to their appointment. The brainstorming feedback process. I realized what better way to help with my brainstorming process than to shift my perspective and ask the patients themselves. I talked to coworkers and even some nice friendly patients coming in for their non-invasive cardiology procedures to see what they thought about my ideas to solve the problem of missed appointments and or no-shows. The main reason they liked it is because not only did they get a reminder about the day and time of their appointment, they could watch a video that described in detail what to expect and how to prepare for their procedure. Other patients like the idea of watching a short video that explains about the outpatient testing facility, where to park, and step-by-step directions on how to find their way inside the building. One patient stated, especially the hospital, it's a maze. I also looked at healthcare professionals' point of view. Fellow classmate and registered nurse at Lancaster General Health, Lydia Wolf states, I think the more patients use portals, the more they like them, and they're right. The hospital is a maze, and when I started working here last January, I thought I would never learn my way around here. Also, fellow classmate and tobacco cessation counselor and educator at Lancaster General Health, Catherine Shambaugh states, when we refer people to our quick classes at the Suburban Outpatient Pavilion, we always have to explain where we are in the giant of a building, and people still get confused. So what resources are needed for implementation of the 24-hour patient portal? Meet with the Information Technology Department on how to possibly add these enhancement features to MyLG Health to save time and cost effectiveness. Meet with the Video Production Department to create instructional videos for the patient portal and the time frame that is needed to produce quality educational videos. Meet with the Marketing and Advertising Department to create signs throughout the hospital and outpatient testing facilities announcing the patient portal and its newest features. Finally, meet with patient registration managers and supervisors to train their staff to provide information on the patient portal and the benefits to patients for signing up. Putting all the pieces together will increase patient satisfaction and decrease missed appointments and no-shows. This concludes my presentation on missed appointments and no-shows. Thank you very much.